Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
AMP2.TV presents you and your doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Yes. Team. Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We are servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. And today we have the honor of introducing you to Wendy Elliott, who is the Assistant VP to the Marcus Neuroscience Institute at Boca Raton Regional Hospital. They can be reached at 561-955-4600, and that's right here on 800 Meadows Road, Boca Raton 33486. The website is www.brrh/services Marcus Neuroscience Institute. Now, Wendy has a very impressive bio. I'm just going to go over this, and then we'll delve into the conversation. Wendy has the oversight and overall responsibility for the 20-bed Neuro ICU step-down unit, Epilepsy Monitoring Unit, 8 pre-post-operative beds, 4 operating rooms with both intraoperative MNI and CT capability, 20-bed med tele unit, and the neurology, neurosurgical spine, and pain clinical practice with 15 physicians. She oversees the comprehensive stroke program as well as the Center of Excellence for Spinal Care, with plans to oversee the expansion of services in the Boynton Beach area. Wendy also oversees inpatient rehab and the Gloria Drummond Rehabilitation Center, which includes cardiac and pulmonary rehab, wound care, hyperbaric treatment, aquatics, physical therapy, occupational therapy, and speech-language therapy. Thank you for joining us. We appreciate you.
I'm so excited to be here.
You are a very busy person.
I'm very busy. Yeah, it's very busy, but I love it. That's all I know how to do.
That's good. And some people work really well being busy, you know. So
yes, when I don't have anything to do, I create way too much chaos.
So Wendy, do you mind sharing with us a little bit more about the Marcus Neuroscience Institute and its role in the community? How long has it been around? What is the main intention for that institute?
Absolutely. So the Marcus Neuroscience Institute, the conception of it was about 2014.
Okay.
And it was originally planned through the philanthropic support of Mr. Bernie Marcus, who is our namesake, obviously the Marcus Neuroscience Institute. And he spent 6 months here, 6 months in Atlanta. And he also was very philanthropic to Piedmont and Emory and Grady while he was in Atlanta. So when he was here, he wanted to have the same kind of services that he had in Atlanta, so he and his friends could have a facility that would take care of any of their neurological needs if it happened, particularly around stroke. Stroke was his primary area of expertise. So with his initial gift, we were able to build a 2-story building that encompassed not just what all you talked about, which was the ICU, the step-down beds, but also a clinical practice where we have neurology, neurosurgery, pain management, psychology, and psychiatry there. So all of your neuroscience, anything to do with brain and spine, we can take care of you. So with all those things being said, since 2014, we've expanded from, I think, 5 physicians to where we have 23 physicians now. And we've also expanded into the Boynton area already with Bethesda East and Bethesda West, where we can do neurosurgery, neurology, pain management, and those 2 facilities as well. So we have 3 satellite locations, one in Hillsborough, one in East Boynton and one in West Boynton, so that we can see patients on an outpatient basis.
You know, I feel so blessed to live in South Florida. I feel like we have access to so
Yes.
much technology and so many resources, thanks to people like the Marcus Institute that
Yes.
have just continued to
Right.
grow and evolve and expand. I mean, we're really, really blessed to have all of these amazing opportunities. It seems that you keep adding on and you
Yes.
keep wanting to expand. What makes it different? It sounds very unique. I feel like there's a lot of differentiating facets between Marcus Neuroscience Institute as opposed to maybe others that are out there.
Sure. Well, one of the things that we've, the Boca Raton Regional Hospital has always been founded on is philanthropic support. And, it comes from a tragic story initially when it was initially built in 1967 with the passing of Gloria Drummond's 2 children. And there was no hospital here in Boca, so they had to go to Bethesda. And by the time they got there, the children didn't make it. So she came back and said, we're going to make a hospital here, and pulled all of her friends together, and they created a thrift store, which is still here to this date. So it's the the Debbie Rand thrift store. It's right on our campus, and so through that initial philanthropic support, she was able to raise enough money to build a small hospital, which has become what we are today. And it's even, if anybody's been on our campus lately, that there's a major reconstruction that's going on because we've expanded a lot of our services. And through the philanthropic support of the Boca Raton community, we've been able to do a lot of this. We would not be able to do it without that. I've been in a lot of different locations, and I've never seen the passion or the compassion from the residents in this area to be able to create what we have, not just from a neuroscience perspective, but from a cancer perspective, from a women's center perspective, from just the campus in itself. So it's been amazing to have that support.
What a bittersweet story. I did not know that, and I've been to that hospital visiting friends. I didn't know her story, and hearing that story is just another reminder of how something wonderful and beautiful can come out of something tragic. It really can. So, wow, I didn't know that. I'm happy to have learned that, so thank you for that information. Maybe you want to share with us any new technologies that are coming down the pipe, or anything that we can share with our listeners that you have?
Well, I've been in the neurosciences pretty much all my career, which I'm not even going to say how long that's been. But
5 years.
We've always been 5 years. We've always been the touchy-feely type of disciplines where we didn't have a lot of technology, we didn't have a lot of things. I mean, the surgeons had skills to do surgery, but the last 5 to 10 years, we have been inundated with technology from the neuroscience perspective. Our surgeons have technologies in robotics to do minimally invasive spine surgeries now. So you don't need, to have humongous surgeries anymore to get your back fixed from the pain. We have AI now that can help us detect a stroke that's happened before we can even, see the patient. And so as soon as we do a CAT scan of the head, we can see that it's a large vessel occlusion, and we can get them immediately into a very technological room that has, it's called a biplane, but that you can take the clot out of the brain immediately and almost totally resolve the stroke symptoms. So there's so much technology that we have. And again, through philanthropic support, we're able to get it. We just obtained a high-frequency ultrasound, which if someone has essential tremors and they can't control it, it is basically a non-invasive surgical procedure, I guess you call it, even though it's non-invasive, that can eliminate those tremors immediately. And it's like, I witnessed a couple of those, and it's just like incredible. They come out, they can't even draw, they can't bring water to their mouth. And after the treatment, they can draw a circle, they can drink without any tremors, and it's like an immediate component of things. So again, through our philanthropic support and support of our leadership, we're able to bring all this technology to the Boca Raton area. And you know, we're not just a local community hospital anymore. We're more of a tertiary facility that can do amazing things and help people immediately.
Oh, yeah.
And those are just a few of the things that we have.
I mean, from what you're telling me, I picture people coming in from all over the
Yes.
United States, or maybe even from other countries, just to get some of the treatments that we have available.
Absolutely, and we get people from all over the place. And you know, I was meeting with a potential donor today, and in the old days, and we even have it in our old commercials, that it was like, you know, where do you go for the best care? And they say the airport. Right? Because people that lived in Boca weren't from Boca, so they would go back to New York. They would go back, you know, to somewhere up north where they felt that there were better care.
Right.
They don't say that anymore.
Nope, not anymore.
Because we have all of that, and we have amazing physicians. We have amazing, you know, technology and facilities that, you know, they don't have to go anywhere now.
Do you do clinical trials?
Yes.
Oh, okay. So that's another great avenue, because with the clinical trials, then tell us a little bit more about that.
So being an institute means that there are certain criteria. You know, you just can't call yourself an institute, right?
Right.
So you have to have certain categories to make that happen. So research is a huge part of that, and all of our physicians are either you know, the PIs on clinical trials, or they're starting their own clinical trials, or they've published in you know, in national magazines in their research. So one of the things, because of the philanthropic support that we got to do an expansion in the back, we have a translational research lab that we have a postdoc. We are actually looking at cells. We're doing stem cell work. We're doing...
That's huge now.
It's huge now. And we're able to take a brain tumor section and look at it through the cytometer and figure out if there's certain medications that might help a glioblastoma. I mean, we're far from having a cure for that. That's one of the deadliest brain tumors there are, but we have the capability, and we have the wherewithal to know it. And from a clinical trial perspective, you know, we do clinical trials in dementia. We do clinical trials with stroke. We do clinical trials with multiple sclerosis and movement disorder or Parkinson's. So anytime that there's a clinical trial and we find that it's appropriate, you know, our physicians will, you know, become part of that. So we have a huge, just from a corporate structure too, now that we're part of Baptist Health South Florida, you know, we have a whole infrastructure around research, not just locally, but now we have a corporate structure for that. And also we have affiliations with Scripps. We have affiliations with Duke, with, you know, other campuses, academic facilities that have those capabilities.
So Medicare is accepted?
Yes.
Okay, and private insurance as well?
Yes.
Or, okay, so good to know. So if someone's listening right now and they're thinking, oh, you know, I think my mom would benefit from, you know, learning she's got a problem going on or whatever. So yeah, we want them to call. I'm going to give out the number again because I think it's really imperative that people call and make an appointment, and then we're going to take a quick commercial break after this. So the number is 561-955-4600. Please definitely call and find out a little bit more if you have any questions, and we're going to take a quick commercial break and we'll be right back. Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We're servicing Palm Beach County, Broward, and Miami-Dade. We can be reached directly at 954-717-7027. We are back with Wendy Elliott, who is the Assistant VP to the Marcus Neuroscience Institute right here at Boca Raton Regional Hospital. Again, the number is 561-955-4600. And it's been such a delightful conversation, and to really educate myself on all of these services that you have at the Marcus Neuroscience Institute. And I know you are one of the top programs here in South Florida. Is there something maybe about the dementia program or something that we were wanting to touch on?
Sure. I want to talk about we have like amazing programs in a lot of different areas. The dementia one is going to be our newest comprehensive one, but we do have a certified spine program. We have a certified stroke program, one of the top certifications that you can have. So we are a comprehensive program. So, and please, if you have any signs and symptoms of stroke, call 911. Don't wait.
Yes.
Please don't wait, because that is important and vital for us.
Yeah.
There's a time component to it. If we don't get within that time frame, then our chances of recovery is limited. So I always want to get that out there. We have an Epilepsy Monitoring Unit, which is certified as well, and we have the only one that's certified in Palm Beach County.
Wow.
So anytime,
that's impressive.
Yeah, anytime that there's an issue with any seizures that you just can't control, and we need to look at medication management or the potential for surgery, unfortunately, we can do that within our hospital. So the dementia program, though, is I'm extremely excited about it. It's near and dear to my heart because of family that have and that are currently experiencing that, and we live in in a time where the baby boomers are getting older, and we're starting to to see a lot more of this happening. And we've always taken care of our patients with dementia and Alzheimer's, and there is a difference.
Yeah, I was going to ask that.
Yeah, so Alzheimer's is one form of dementia. There's 230 different types of dementia.
Wow.
So depending upon the type, there's different treatments for it. But we know that there is no cure. There's no cure for Alzheimer's, but there's hope. There's hope now because there is current research and current medications that are now coming out that are getting FDA approved, and that we potentially can prolong it's not a cure. Right. It's not a cure yet. We can give that white flower out eventually, and I have no doubt, but at least there's an opportunity to have someone remain with us cognitively for a longer period of time now. So that's exciting. But one of the things that I'm extremely excited about is that we have, starting February 1st, our new physician, who's a cognitive behavioral physician, that will be working with us and, coming with me as an administrative lead to develop a comprehensive program. I've done this in my past.
Wow.
I've done this at other facilities, and, where it's not just necessarily about the patient or the person with Alzheimer's and dementia, it's about the caregivers, and it's about the community resources.
Absolutely.
People don't come to our hospital because of Alzheimer's or dementia. They come because they have other medical issues, but once they're in our hospital, once they get confused, they get agitated, and I need my staff in the hospital to understand how to redirect, how to work with those patients to make sure that they're safe, number one, but make sure that we're continuing to provide the best care. So with our new physician, you know, we're going to be working with the Alzheimer's Association. They have their first gala in March,
nice.
and I'm on the board of the Alzheimer's Association of South Florida as well. And my two physicians, my cognitive behavioral neurologist as well as my neuropsychologist, will be on a panel discussing all the new components of research and things that we have to look forward with, and the things that we're looking to do in Boca to be able to support our community. And I'm excited about that.
I am too. It sounds like better quality of life
Yes.
is what you're saying,
Yes.
is what I'm hearing. That people don't have to feel, you know, you have a lot of new medicines, a lot of new treatments coming down the pike. So that's what we want, is for our loved ones to have a better quality of life. So, and I know that they're doing everything in their power to find that.
And those are part of the clinical trials that we want to start. You know, and this is what makes neuroscience, you know, we talked a little bit about, you know, why is neuroscience so interesting? To me, I've been in neuroscience my entire career. I'm a speech language pathologist by training, so I started out working with neuro patients and, you know, have continued to not necessarily be a direct care provider anymore, but still managing and working with patients with cognitive and, you know, neuroscience injuries or issues. And so this is like the exciting time.
It sounds
of
like
it. That there's so many things that are like coming up with, you know, like it's almost to the point where we can say we have a cure.
Right. That's exciting. It's on the horizon.
It's on the horizon. I have no doubt that it may not be in my lifetime,
but it's coming.
Yeah.
So what do you see the landscape in the future of neurology and changing over the next 10 years to come for patients in various neurological deficits? So I know we said it's coming, it's on the horizon. You know, next 10 years, because just think from 10 years ago till now, right?
Oh my gosh.
2014 to now 2024, we've taken leaps and bounds. What do you think 2024 to 2030?
Well, we know that the landscape of healthcare, I mean, since I've been in it umpteen years, you know, we've gone from having patients in the hospital for months to having patients go home the same day of surgery.
Wow, this is true. I've heard that. It's like,
and it's
fascinating.
Okay. I mean, I remember as a therapist, I'm like, they can't go home yet, they need me, right? But you know what, they're doing okay.
Yeah.
We have resources that get them out sooner, because we know that people in the hospital, you shouldn't stay in the hospital any longer than you need to, because you know, you could end up in a worse condition because of a lot of other things. But the landscape of neurosciences is going, we're doing a lot more of our surgeries as an outpatient. We're getting patients to rehab sooner. We're getting patients out of the hospital sooner. They're getting better. We have so much technology now. I mean, just from a spine perspective, going from having to like totally go and open up a patient to minimally invasive, where you can't even see the little line, and they're doing all the instrumentation on the inside. Same thing with brain, you know, any type of brain surgery. We have, you know, the ability to do, you know, we can, for epilepsy, we can put the electrodes internally without having to shave their head and do an open craniotomy.
Come a long way.
We can do thrombectomies without having to open, you know, so there's so many things, and I'm just excited that our patients with neurological diseases now have options.
Absolutely. So we're winding down the interview. We have 3 minutes left. Is there maybe something that stands out to you, a story or an event or something in all your years of experience that you want to share with us before we close out?
There's so many stories.
I'm sure.
I mean, so many stories that are great. Every place that I've ever been, every patient that I've ever spoken to or worked with has had their own individual story. One of the ones that I think, and I love her to death, she was one of our patients here at Marcus and has been an advocate for us. She had 2 brain tumors.
Wow.
Both times having had surgery, and was going to support groups for, you know, for brain tumors, and said, you know what? I don't want to be a patient. I don't want to talk about I don't want to talk about the drugs that I'm on. I don't want to talk about the care that I get. She goes, I want to be a person. So she came to my medical leader And she's like, I want to do a support group that's wellness related.
Nice.
Right?
So she changed
She changed
from victim to victor.
Right.
Victorious.
So he's like, well,
Nice.
go talk to Wendy. And so she came to talk to me, and I'm like, I love it.
That's
Let's do it.
amazing.
So about 3 years ago, we started our support group called Wings. It's Wellness
it.
Inclusive Neurological Group.
Thank you so much.
So,
we have to wrap
we're
it up. It's been
excited.
a quick interview.
know.
Thank
Well,
you so
thank
much for
you.
coming. We appreciate you and your time.
Thank you so
Thank you
much.
so much, everybody. We'll see you next week. Thank you so much for tuning in, and have a great night, everybody.
Good night.
Good night.